Carpal tunnel syndrome is a common yet debilitating condition, so knowing how to take a focused history and examination is important for medical students in both clinics and exams. This video is aimed at giving a brief overview of the structures forming the carpal tunnel. It will also explain what to look for in a focus history and examination. Finally, we will look at the possible tests and management of carpal tunnel syndrome. The carpal tunnel is a structure within the palmar side of the wrist, bounded by bones and ligaments, namely the scaphoid tubercle and trapezium radially, the hook of hamate and pisiform ulnarly, the proximal carpal row dorsally, and the transverse carpal ligament or flexor retinaculum palmally. Running through the carpal tunnel are the flexor digitorum profundus tendons, the flexor digitorum superficialis tendons, flexor carpi radialis, flexor pollicis longus, and the median nerve. The median nerve is key to carpal tunnel syndrome. Symptoms arise from the compression of this nerve by local structures such as the transverse carpal ligaments. This results in higher pressure within the carpal tunnel during flexion or extension. The median nerve supplies sensation to the radial 3.5 fingers. It is also the only nervous supply to abductor pollicis brevis. The other thenar muscles are supplied by the median nerve, but they receive dual innervation from the ulnar nerve. Patients will complain of numbness and tingling in the radial 3.5 digits, along with clumsiness or weakness. They may also complain of pain or paresthesia that wakes them at night and is relieved by shaking the hand. When taking history, ask about any repetitive motion or vibration. For example, having a job with manual labor, or at a desk, or sports. Check if the patient could be pregnant, and also check for history of any associated systemic disease and risk factors. When examining the hand, we use the general structure of look, feel, move, and special tests. When inspecting the hand, look for thenar wasting, carpal tunnel surgery scars, and any other swellings in the wrist. To test motor function, palpate the drumstick-shaped thenar eminence while testing resisted abduction. This tests abductor pollicis brevis in isolation. You can also look for the anterior interosseous nerve sign. This is the inability to make an O with the index finger and thumb due to denervation of the FTP to the index finger and flexor pollicis longus. To test nerve supply, check the sensation at the index and little finger. Check the hand affected to test between the ulnar and median supplied regions on that hand. You should also then check between hands. Finally, the special tests are Tinel's test and Phelan's test. Tinel's test is simply tapping along the volar surface of the hand and wrist from distal to radial, asking the patient to let you know if they feel any shooting or tingling sensation. Phelan's test is carried out by asking the patient to flex at the wrist for 1 minute. Phelan's test is positive when the patient reports tingling or shooting sensations within that minute. Carpal tunnel syndrome is a clinical diagnosis. While electromyography or EMG and nerve conduction studies can be carried out, they are negative in approximately 20% of patients. In terms of management, first line, it's recommended to use non-steroidal anti-inflammatory drugs, or NSAIDs, wearing a splint at night in the neutral position, and activity modification, such as keeping desks at the appropriate height at work and avoiding handling vibrating motors in manual labor. Second line, local anesthetic and steroids can be injected into the carpal tunnel. And third line is carpal tunnel decompression surgery. This is usually reserved for the failure of non-operative management, or in cases with penile weakness and atrophy, EMG abnormalities, or known extrinsic compression from a mass lesion. In summary, carpal tunnel syndrome is a common condition of the hand and wrist. When taking a history, take note of the distribution of numbness and tingling, as well as the functional status of the patient. Check relevant social history and risk factors. Examine by inspecting, checking motor function and sensory deficits. Conclude with Tinel's test and Phelan's test. Carpal tunnel syndrome is a clinical diagnosis with management being escalated from conservative to medical to surgical.